have the best for last. Nah, they're. No, you guys are awesome. Anyway, so we have Anjuli, a second-year master's candidate at the University of Michigan School of Public Health, studying health behavior and health education with a certificate in global health. She's pursued her interests in global health and development by being involved in a global health internship in West Bengal, India, and is currently looking for careers in the global development and community health space. And then we also have Jackie Wolf. She is a recent graduate of the School of Information where she specialized in human-computer interaction. Her interest in UX and international settings has led her to work for social enterprises in both Paraguay and India, where she has worked with organizations to develop innovation solutions to poverty and unemployment, as well as maternal child care in rural settings. And she's currently working as a web project manager for Michigan Multimedia at the University of Michigan and moonlights as an entrepreneur and CEO for SWIC Tech, the makers of the broken. So, ladies and gentlemen, Anjuli and Jackie.
First, we're going to do something really weird because we're the Kalikatas and that's what we do. So there were 3 of us that went to India. Get over here. And we took lots of selfies, which feeds into Aishwarya's talk. But we're also going to mess a little bit with a coworker's sense of identity, his professional identity. So bear with us. We're going to take a selfie with here, and we're going to have you guys all wave to Nick in just a minute. And thank you, Kat King, for this beautiful rendition. It's lovely. I can't think of a better invitation. All right, let's flip you around. All right. Everyone ready to wave? Get in here. All right, thank you. Perfect. Thanks, everyone. Thanks for bearing with us. I'll put Nick away. Got it? All right, so last summer, the University of Michigan sent the Kalikatas, the 3 of us, over across the world to rural West Bengal. And so basically this was, there are 3 of us, go back. The 3 of us that represented the School of Public Health, the Masters of Health Informatics organization, school, and the University of Michigan School of Information. And so we were working there as health behavioral professionals, user experience researchers, and full stack developers. And so when we landed in India, before we went, we realized that we were really interested in this space because in India, they have very, very poor maternal child health outcomes. The actual access to healthcare in India is very difficult, especially if you were part of a marginalized or rural community. And so what we also thought was really interesting is that in India, more people have access to cell phones than they do clean drinking water and toilets. And so we were really brought in to think about what are some of the tools that we can actually create to really help solve this problem of bridging communities, especially rural communities with a formal healthcare system, while taking advantage of the readily accessible technology of cell phones.
And so just based on what we had done in terms of research before we had gone to India, we realized that these community health workers serve as bridges between the communities that they serve and the formal Indian healthcare system. And they usually do a wide variety of tasks within these communities, from general patient data collection to more clinical care when it's required. And they are very much the primary healthcare providers in settings where people otherwise wouldn't have access to healthcare. And we also realized that there were a variety of types of health workers that work in these settings. And that information was provided to us by our clients when we had, before we had arrived in India. And so with that kind of knowledge, we had used that to shape some of our understanding of what this project would actually look like. And so our goal with this app was to kind of enhance this interaction between the health workers and their communities by streamlining data collection, streamlining home visits, by allowing community health workers to input data into a mobile device instead of having to take a lot of time recording notes via paper and pencil. But what we didn't realize through a lot of our literature searches and with conversations with our clients is that health workers in West Bengal face a lot of very nuanced challenges. Whether it's lack of time, poor compensation, just a wide variety of knowledge around not just healthcare but also technology, we realized we had to go back and kind of revisit some of our general and foundational assumptions that we had going into this project and going into India. And so a lot of the process that we did over the summer was doing field work, a lot of user testing and in-depth interviews with health workers to better understand the environmental context in which they were working in, and to better understand some of those more detailed challenges that we weren't able to glean just from literature searches back in Ann Arbor. And in that sense, public health and UX is very similar because it's all about better understanding who these users are, what these communities are like, and you can't really do that when you're so distant from those communities. And so part of the things that we learned included knowing what the mental model for data collection looks like for the health workers. And you can see from these different images that even though data was being collected on paper and it was time-consuming for the health workers, it was very organized and very detailed to better understand the health status of each patient that they were seeing. And that's not something that we had understood back in Ann Arbor. We had assumed, and also in conversations from our clients, that they would need a completely new type of way of looking at patient information and how to collect it. And so the app that we had originally developed did not match this model at all. And so we had to go back and continually revisit this to better understand that process and what that flow looks like. Another thing we had to consider was just being outsiders to these different communities and not understanding the language barriers that we were dealing with. And so part of the thing that we had to kind of work with was whether we needed to use an interpreter, especially someone who can kind of filter what the information is being communicated from health workers through their own lens versus a translator, someone who is told to communicate exactly what the user is telling them back to us in a way that can give us the most valuable information. And so initially we had someone from our company that we were working with be sort of an interpreter, and that definitely altered the lens in which we were looking at the problems. And later on we ended up incorporating a translator into this process, and we ended up gleaning a lot more valuable information that way.
All right, so the point of our talk is our very first field visit. We were there for about 3 or 4 weeks. We had built this prototype. We were going into the field to test it, have these community healthcare workers play around with it. And I had a series of questions that we had set up. I had assumed I would know the answers to them, but I was asking them anyhow. And one of those questions was, what is your point of frustration? And I assumed the community healthcare worker would have said, oh, well, there's a lot of families that I'm required to visit and I don't have enough time in the day. Or there's a lot of data I have to enter at the end of the day and I'm really exhausted. And instead what she said is, we don't have a bridge. And so this dry riverbed over here is what we cross to get into the village during the day. And it turns out for 8 months out of the year, it's dry and it's passable. For 4 months during the monsoon season, the riverbed fills up and this village is cut off from the rest of the community. And so the health worker talked about basically a pregnant woman she'd seen through her entire pregnancy up through month 8, and the woman fell. And because they couldn't get across the river to the other side of the community, the baby died. And so I think that was really heartbreaking for us because we're saying, okay, we have this really great app for you. It's going to take care of your data entry. It's going to help you communicate with doctors. But we realized she doesn't need an app. She needs the actual infrastructure to get her from one side of the river to the other side. And I think that was really humbling for us, really being there as developers, saying there's a lot of focus on developing a product and something you can execute, give to the community, and leave, without a lot of real reflection back about like, what kind of impact is it actually having on the community? How useful is this as a tool for them? And so from there, we had to take a step back and really reflect on, well, we're still going to be developing this tool. We still have a commitment to our partners, and we still think there's a use to this, but how do we actually reframe it for the community that we're working with? And so from then, for our additional interviews, we started talking to them about how this can be a tool they can use to really communicate with doctors. So if this is a situation where this happens again, and you can't get to the other side of the river, instead you can be really talking to a doctor on the phone so you don't feel as alone during those moments when you're trying to help this woman through basically a miscarriage. Or instead you could take this back to your government and say, this is something that's happening very frequently, and this is irresponsible, and this is not something that should be going on. So you can use this as a point to really move the community forward. And I think for us, Anjuli brought this up to me, it really made me reframe the way that I think about what we were doing there. And being in India for 2 months, you think it's a large amount of time, you can get a lot done. But to Jessica's point, really it takes a lot of time to get immersed into a community to actually make a real difference. And so for those extra like 7 weeks we were there, 6 weeks, we weren't there that long, I had to really rethink about how am I taking this framework to think about what we're designing for the community? How do I focus less on the product and more on the end users? And how, as a user experience researcher, my job is to be a user advocate, not necessarily just a stakeholder advocate. So I wish at the end of the project we could say we took this app and we built a bridge for this community, but I can't. And I think this has been really something that we've grappled with a lot. How do you talk about this project as something that's a success? Yes, we left them with an app. Yes, we talked to communities. But realistically, it was a very difficult project to work through. And so I think what we're focusing on more now is how do we take the information that we've gleaned that wasn't reflected in the literature searches that we were doing and really push that back into the community. And so step one is kind of what we're doing here now, is really telling you guys our story. And then step two is figuring out how do you spread it further. So thank you.
Okay, so questions? Okay. Think you can raise your voice?
Have you been able to follow up with the organization you were working with since you left India?
So we haven't followed up directly, but kind of through roundabout ways, we found out that they're still getting more investors in kind of more local setting to kind of push this project forward a little bit more. It's not clear whether or not the documentation we left is being used, and I'm not sure what the status of the application is at this point, and if it's actually being used in the communities. So those are a lot of unanswered questions.
Yeah, I think a hard part towards the end is we realized that I mentioned advocates for users, not for stakeholders, because our stakeholders, once we brought this information back, didn't feel that this was valuable information, because we learned that they were really just interested in us developing them a product for free that they could then distribute to the government and to other organizations.
Yeah. Other questions? This is blatantly not a question. It instead is an expression of gratitude. It's so rare that at an event like this we get to hear about something where a designer's expectations weren't met, or at least the frame of the talk is that everything went perfect and we succeeded in our goals. And I think one of the earlier speakers talked about vulnerability, and I want to thank both of you for being vulnerable today. That's really hard to say that our app wasn't the most successful thing in the world and ultimately didn't solve the most pressing issue that this community was facing. So thank you for creating that space today, for bringing your own story. If I am going to ask a question, quick save, I would ask, do you know if there are any other outlets where people who are working in information fields can talk about their projects and in the ways that they weren't necessarily successful or met, their best expectations? And what do you think is the value of talking about things in this way?
So I personally haven't come across any conversations I've had about this have really been from person to person. I've been in personal contacts and personal networks. I have had friends that have talked at like the Medical Library Association and Modern Language Association on projects that specifically failed because those really don't come up very frequently. And I think taking a step to the side, that's also a problem we have in research a lot. There's a lot of publication bias that I think is a problem because people publish what is successful, they don't publish what hasn't been. And so I really think as a community, overall, it is an incredibly important discussion to start having. But I think it's really hard to be that first person out there that talks about it, because who wants to hire someone that had a really terrible app that didn't solve anyone's problems? No one wants to be that first person, and I think it takes someone that has a lot more clout within the community, that has been seen as really successful, to start talking about it. So I don't know if I don't think the solution is like, oh, let's have a Slack channel where we all talk about like our problems. I mean, that might be kind of great. I would join. But I think it is just, I appreciate the support support you said right there. I think it's being validated that even though we don't have a solution to the problem, that maybe the first step is really talking about the fact that we should just concentrate on the solution, that should be the end goal. Maybe like it's falling low with the problem instead.
Did I see any questions here? No? No?
Scott, you don't want to?
Okay.
I have, it's probably not a question, just like you said, more of a comment. In the health research field, there is a term called helicopter research. And it's this idea that a researcher flies into the community, does research. And we're working with communities where we're realizing that it's extremely dangerous and sort of, in a way, counterintuitive. It burns bridges rather than building them. Victor Papnek, who was a great designer, I think in the 60s, wrote a book called Designing for the Everyday Life or something like that. And he mentions a lot of great products or ways in which you go out in the community, stay with the community for a while, sort of kind of what you were saying, to build solutions and fail and then build again. So just like the previous comment, I'm really appreciative of you bringing this up and talking about this in such a helpful public way. Thank you.
Thank you so much, guys. We really